My name is Dr. Marybeth Maritim. I'm a senior lecturer in Department of Clinical Medicine and Therapeutics. I'm also a consultant physician, both at Kenyatta National Hospital and Bagathi County Hospital. I also co-chair the Advanced HIV Disease Subcommittee within NASCOP. So advanced HIV disease is a name that refers to patients who have HIV and their illness is progressed. This is actually the patients who a long time ago were called to have AIDS. They have serious opportunistic infections and they present in the last stages of HIV infection. So in terms of the WHO definition, we look for advanced HIV in certain groups of patients. Patients who are newly diagnosed with HIV. We also look for advanced HIV disease in patients who have treatment failure. And we also look for advanced HIV disease in patients who had dropped out of care and are coming back into care. So we use a diagnostic test where we measure the level of their immunity. We call that CD4 count. So for patients who have a CD4 count less than 200, they qualify to be said to have advanced HIV disease. The second category of advanced HIV disease, again among adults and adolescents, is patients who have WHO clinical staging, stage 3 and stage 4. The clinical staging is a tool that we use where we look for certain diseases that occur more commonly in patients who have very late stages of HIV. So diseases like tuberculosis, some forms of meningitis like cryptococcal meningitis, those are some of the examples of WHO stage 4 diseases. So when patients are newly diagnosed with HIV, we cannot be able to tell how long they've lived with the HIV, and doing the CD4 count, which measures the immunity, is able to tell us whether the immunity is low or high. If a patient has a high immunity, like if the CD4 count is more than 500, that patient will not get some of these infections. They're called opportunistic infections because they take advantage of the low immunity to cause infections in the patients. So patients who have a high immunity with a high CD4 count, they are not at risk for opportunistic infections. But patients who are newly diagnosed, if they've been living with HIV for long and they've not taken any treatment, most likely their immunity will be low and therefore they'll present with opportunistic infections. So we do the CD4 count for newly diagnosed patients. Also, we know that many of our patients now are coming to hospital. They started antiretroviral therapy, which is a treatment we give for HIV, and then they stop. So when they stop the treatment, the immunity goes down and they present with the opportunistic infection. So it's important for us to identify if they have advanced HIV disease. The third group is patients who've been taking their antiretroviral therapy for long. If you take the antiretroviral therapy for long, sometimes the virus can develop mutations, and at that point in time, you start developing resistance to the antiretroviral therapy. So in that group of patients, again, we monitor them with viral load. So patients who have a high viral load, it means the virus is multiplying in the body. And when the virus is multiplying in the body, it damages the immune system, and that contributes to lowering of the immunity. So patients who have consistently high viral load, we also look for advanced HIV disease by doing a CD4 test for these patients. And once we identify patients who have advanced HIV disease, because they are at risk for opportunistic infections, we start looking for specific opportunistic infections. In Kenya, many of our patients are presenting with tuberculosis. So we have certain tests that we do to look for tuberculosis in all patients who have a low CD4 count. We also look for evidence of cryptococcal disease. So cryptococcus is a fungus that eventually goes to the brain, but you pick the infection through inhalation, multiplies in the lungs, spreads in the blood, and eventually goes to the brain and causes a serious form of fungal meningitis, what we call cryptococcal meningitis. So as part of the committee within NASCOP has put in place this committee to be able really to provide guidance in terms of what needs to be done to provide care for these patients. So the biggest concern has been, we've been giving antiretroviral therapy in Kenya for more than 20 years now. And we have achieved a lot of goals, but we know that there are patients who are not taking their treatment. They present to hospital and they die. So currently we actually have more than 20,000 patients who die every year because of advanced HIV disease, and they present with opportunistic infection. So to respond to this increased deaths in our patients, within the committee, we've set up structures to develop centers where patients can actually be cared for. So we've identified county referral hospitals, all the county referral hospitals, 47 of them, plus other additional hospitals within the various counties, where we are establishing resources as well as human resource and even treatments to be able to take care of these patients. So within the centers of excellence, what we are also calling hubs, we are developing human resource in terms of training a multidisciplinary teams of healthcare workers to take care of these patients. We are also ensuring that these centers of excellence have laboratory capacity to be able to diagnose advanced HIV disease by having CD4 testing, but also diagnose the serious opportunistic infections such as tuberculosis, cryptococcal meningitis, among others. But more importantly, we are also providing treatment. So the newest treatments that have been introduced in the country are found within the centers of excellence. So in the centers of excellence, the sickest patients who come with opportunistic infections require to be admitted in hospital. They require to be treated in hospital. They are not stable enough to be treated in the community. So they have to be able to be treated and be cared for. So we have also provided the best treatments for these conditions in the centers of excellence. So what we are really working towards is to train this multidisciplinary team of healthcare workers to be able to treat this patient for the duration of their admission. And then once the patient is stable enough to be discharged, they can be discharged and continue the treatment in the community. So one of the things I forgot to mention is that treatment for opportunistic infection is a bit complicated. Sometimes you have to keep the patient in hospital for a week, 2 weeks, even sometimes more than that. So you have to offer the treatment, the ideal treatment in the patient, and that's what we are aiming for within the hubs. But we have also spokes, which are lower level facilities that can be able to diagnose patients. And if they cannot be able to treat the patients, they refer them to the centers of excellence of the hubs for treatment. So my parting shot is that in this conference, I have given a talk on advanced HIV disease, and the main essence of that talk was really to sensitize physicians, because I would like the physicians in Kenya to own the care of the seriously ill HIV patients. And that's why even with the Kenya Association of Physicians, we'll have ongoing engagements to be able to build capacity for our physicians to take care of these sickest patients within the hospitals whenever they are admitted.